Good evening. Thank you all for coming here today for this event. My name is Zhiguo He. I'm a professor of finance at the Chicago booth and a pharmaceutical director at Chicago booth. It is my pleasure to welcome you tonight to the event hosted by BFI China, Will the Coronavirus Derail the Global Economy? As you may know, the Becker Friedman Institute for Economics serves as a platform for the 250 plus economists on the University of Chicago campus. In 2018, we launched BFI China in order to bring the rigor of Chicago economics to the forefront of addressing the challenges that the Chinese economy and the world is facing. This groundbreaking partnership between UChicago economists and the Chinese researchers and institutions will produce new insights on these critical policy challenges and aim to share these findings with the world. Under the umbrella of BFI China, we are organizing today's discussion on a significant issue that is facing both the China and the world right now. The rapidly evolving coronavirus outbreak has led to significant speculation in the media about the global economic and health implications of the crisis. One of our goals with this roundtable is to shed light on what we know and perhaps debunk some of the myths that are circulating around the potential epidemics. We have a great panel today, experts joining us tonight. The full bios are in your program that are in your hand, but let me give some brief introductions. First of all, I would like to introduce a close colleague of mine, Chang-Tai Hsieh. Chang-Tai is a professor of economics at the Chicago booth, as well as a director of Chinese Growth and Economic Initiative for BFI China, and a co-director of BFI's Development Economics Initiative. Next to Chang-Tai, I would like to welcome Emily Landon, Associate Professor of Medicine and Executive Medical Director for Infection Prevention and Control at the University of Chicago Medicine. Finally, I'd like to welcome back to campus the UChicago alum, Huang Yanzhong. Yanzhong is a professor and the director of the Center for Global Health Studies at the Seton University, and is a senior fellow for global health at the Council on Foreign Relations. To moderate our discussion tonight we're very pleased to have a Vox Science and Health editor, Eliza Barclay. We appreciate her joining us tonight to lead this exciting discussions. With that, I hand this program over to Eliza. Thank you.
Thank you so much. I am thrilled to be here to moderate this conversation with this incredible panel. I'm going to start by pulling up this page. Is it there? Yeah, okay. Just to, you guys can't
it's over
see
there.
it.
No, I'm okay.
But we can see here.
Oh, there it is.
Oh, okay.
Okay. Yeah, so this just can help put this conversation in context. This is the data real-time generated from Johns Hopkins University. It's being pulled from a number of different sources, and we'll let the numbers you can check them out there. I wanted to just sort of set some context for this conversation by walking through a few ways in which this coronavirus outbreak is really unprecedented. First of all, as many of you probably know, that there has been unprecedented information spread. Some of it is misinformation, like the allegation that the virus escaped from a germ warfare lab in Wuhan. And then there is also an astounding amount of scientific information pouring out. There are dozens of clinical papers pouring out of China every day. It's unprecedented in terms of the scientific knowledge being generated and being shared about this outbreak. The size of the quarantine in China is unprecedented. There are currently around 780 million people living under some form of travel restriction. The speed of the genome sequencing of this virus was unprecedented. Scientists in China sequenced the genome and made it available on January 10th. So that was just 1 month after the first case was reported. And you compare that to SARS, it took several months to sequence the genome of that virus. Also, we have a very unusual, although potentially not totally unprecedented situation of the largest outbreak outside of China on a cruise ship anchored in Japan. There are currently over 621 cases of coronavirus out of 3,700 passengers who are on that ship. And it's turned out to be both a tragic but also potentially useful experiment, right? It's a way to test the quarantine measure. I think we'll hear more from Emily about how it's gone. But it's showing us, this cruise ship situation is showing us that this virus is really challenging to contain. So I want to ask a few opening questions of each of the panelists, starting with you, Chang-Tai. So while we don't yet know the full extent of how the coronavirus outbreak will affect China's economy and the global economy, what are the important early signs on that impact?
Thank you, Emily. So I want to stress that it's very early, and there's most of what we want to know we still don't know yet. We still don't know yet, but this is what we're seeing on the ground. That what you see is that big parts of the Chinese economy have shut down. So you think about sort of the basics of getting workers to companies and companies getting their goods out. The travel restrictions is just making that very, very difficult. I anticipate that this is gonna that hopefully that the health issues get settled, and this is gonna go back. This is gonna go back. But I would say that the one thing that I would pay attention to is the following. Or the one thing that concerns me now is that it seems to me that all the signs that I see is that the central focus of the local authorities is to try to do something or appear to try to do something about this, and that is the only thing that they are focused on, and the cost of that is that everything else goes to the side. So we've seen news reports about how people that are sick with other things, they don't get treated. So we've seen news reports. And then the reason I think in terms of the economy, what one needs to be concerned is that the local governments have played the central role in explaining, in creating the conditions for the growth of the private sector that we have seen. That for a long time, for the last 2 or 3 decades, this was one of their central focuses. So the thing to look at going forward is whether that focus is going to come back, or you are going to see the dilution of attention, the dilution of focus going forward towards other things. And we have seen a little bit of signs of this in the last 5 years. Not because of the virus, but a bunch of other things. So looking forward, the thing that I think I would keep my eyes on is what is the local government going to be focused on 2 years from now?
And I wanted to also ask, there was a report in the New York Times today that pointed out that there are some business leaders and economists who are now challenging the quarantine and saying, hey, how long is this going to go on? This is a problem. And so I'm just wondering, what do you make of this growing tension around these measures?
Well, I'd like to know. I mean, that's why I like to know from people who know public health and doctors how big of a risk this is, because the way I have to think about it is that I want to trade off the benefits and the costs. I mean, that's sort of because with my natural.
It's an economist thing to do.
No, that's what we do. Like we rarely think it's optimal to go to extremes, to go to extremes. Or I'll just stick my head out there. That is, if we think about, say, that is, I'll make a claim that if you want to think about how much is the optimal amount of crime, but what I mean, that you can think about a society in which you view that crime is so costly that you're willing to do whatever it takes to bring crime down to zero, right? But that's going to be very, very costly. It's going to be very, very costly to bring crime down. And most societies don't do that. I mean, in some sense, we tolerate some level of crime. Tolerate in the sense that we don't blanket a city with police. We don't keep people in their houses completely. So I would like to know about what the benefits are so that I can think about the cost. And then we can think about what is that optimal balance. And then it could be the case that after we've heard from the medical experts that this thing is so costly that if we don't take extreme measures, then life is going to end. That could be the truth. That could be the truth. Or maybe it's not, and then there's some other intermediate things that we could do in which there's just a better balance of the benefits and the costs. And I think that's what you are saying, that basically you have a bunch of business leaders saying, look, this is extremely costly, right? This is extremely costly, so let's think, so let's have a discussion about what these costs are.
Do you want me to respond?
Sure, please.
There's like 20 things to say.
Yeah.
So, I mean, I'm obviously not an economist, but I think that a couple important things to say about epidemics and outbreaks are that in the beginning, you don't know anything. And this has been, as you mentioned, Eliza, unprecedented what we can know and how quickly we were able to know it. That said, there's still a lot of things about answering those key questions about how deadly it is, how dangerous it's going to be, and how human costly it's going to be. And that really depends on a lot of things that you can't know right away. And I also think that, so anyway, in the beginning, it makes sense, and most public health officials will try and do a cordon sanitaire, a quarantine, whatever word you want to use, they're going to try and contain the virus or the bacteria or whatever illness you're talking about. The best bet in the beginning when you have few cases is to contain. At all costs, contain. In fact, if you could have contained this really early on when it was 20 cases, you wouldn't see any cost. Only like a very small number of people would pay a cost. And there gets to a point where it's not worthwhile to continue to try and contain if it is uncontainable. Now, Dr. Fauci, Anthony Fauci from NIAID has said that once we see 4 generations of transmission, I think Dr. Messier is agreeing with this now, when they see 4 generations of transmission. So I'm sick, I make you sick, you make someone else sick who wasn't here tonight, and they make their family member sick. That's 4 generations of transmission. And when we see that it will be no longer appropriate to try and contain the virus within the United States, and we should switch to a mitigation strategy. This sounds a little terrifying when you're talking about a virus that you've never heard of, that you've never seen, that's killing thousands of people half the world over. But it's not. It's actually very much like what we're doing right now for influenza. We have vaccines, we have medications, we have treatment facilities. We try and keep people who are at higher risk of influenza away from people with influenza. We try and make sure that we're mitigating the damages that influenza does every single year. But knowing when to draw that line is hard, especially when you're the first country that has it, because there's also this sort of social issue of if China is unable to contain it, it will spread to the rest of the world. It will be seen as a Chinese problem, which it is not. Viruses don't care what you are or what country they start in. It's not anything to do with that. It's an unfortunate and unlucky event that happens. And this virus appears, as you mentioned with the cruise ship, to be nearly impossible to control the spread of. And so many people in public health are also arguing that it may be time for us to think more about mitigation and less about containment. But that's that's going to be a big shift for Americans, especially. In the U.S., it's a big shift to go from this virus that I'm seeing all these memes about on Twitter and on Instagram, and now we're just going to let it run through our communities and everything's going to be just fine. It's sort of a really, really big shift to make.
And what is it about the virus itself? Is it its high contagiousness that means that is the reason why it's been so hard to contain?
Yeah, I think the methods by which one has to sort of put in that cordon sanitaire, that like the containment plan, in the beginning, no one expected this virus was going to be this contagious, because even like regular old coronaviruses that we get from colds don't appear to be this transmissible. But based on what we see on the cruise ship, it's probably pretty bad. It's probably pretty easy to transmit. Numbers of people, there certainly are now, we can acknowledge asymptomatic individuals testing positive, people with definite symptoms and definite exposures testing negative, so we have sort of an inadequate testing situation. You can't actually be able to tell quickly who's sick and who's not sick. It's difficult then to tell who's exposed and who's not exposed if you think you have to be within 6 feet of someone for 10 minutes, but then it turns out that a bunch of people got sick and they weren't within 6 feet of someone for 10 minutes. Then all of a sudden you have to change everything and all your rules change. And so we have to be nimble, but it's really hard to wrap your head around your own personal health safety and being nimble about the risks that you face as an individual. It's different. I mean, we do certainly do a lot of risk-benefit analysis in medicine too, but it's always left to an individual person to decide what their risk-benefit tolerance is. And that's a little bit different here because public health will be making the decision for all of us. And we don't usually approach things like that in medicine.
Yanzhong, you are an expert in public health in China and the government's ability to detect disease outbreaks. So do you think that the top now, as Emily said, this was an unlucky occurrence that could have happened anywhere, perhaps. But do you think that the top authorities in China did too little, too late, and for political reasons, potentially?
Great question. Well, first of all, I have to confess that I'm not a public health expert by training. Actually, I've graduated of political science department here at the U of C, and I saw my mentor, Professor Dali Yang there. And, my dissertation actually was supervised Professor Yang on health politics in China. So when we look at I guess you are asking the question about the government response to the initial outbreak, yes, not after January 20th. Now I think we have sufficient information. We could sort of connect the dots now, piece together all this information. It should be a more complete picture now of how the government actually responded to the initial outbreak, right? So according to the Chinese scientists, the outbreak probably began as early as November 2019. Then you have this Dr. Li, right, that he noticed something that is dangerous, similar to SARS. So he shared that information with his friends and relatives. Then he was disciplined, for spreading the rumor, right? And of course, later he was infected, and he used his death basically to prove he was not a rumor monger. That was a tragic story, of course. But then you have another doctor who, when she was treating the patients, Dr. Zhang, noticed that this is something really is going to be big, right? That we got to report, right? So she insisted that they report to the up-level health authorities. So the Wuhan Health Commission got that information. I believe through that online reporting system, the national CDC also got that message. That is why on December 31st, right, the national CDC sent a team to investigate what happened in Wuhan, right? And there, I think their conclusion probably supports this human-to-human transmission, right? So that is why China then shared that information with the WHO and the United States on January 3rd, right? At that time, points to human-to-human transmission. And President Hsieh apparently also got that message, right? So that is why on January 7th, right, he issued that directive, right, on taking actions on the outbreak. But we don't know the exact content of that directive, but the people suspected it was very likely that you got to do something on that But in the meantime, don't ruin the atmosphere for celebrating the Spring Festival, right? So for the local governments, that was a very difficult decision to implement. And that was also compounded by these so-called two sessions, right, at the local level. Two sessions, that is like the most important political events at the local level, national level, because the political consultative conferences and the People's Congress, right, they elected new leaders. So that was between January 5th and January 11th for Wuhan, right? So you saw that they started to issue, they closed down the seafood market on January 1st. They also issued reports on a daily basis about the outbreak until January 5th. Then they became silent, right? Until January 11th, they again issued a report on the outbreak, right? But again, there was these two sessions at the Hubei, the provincial level, right? So again, you saw this silence, right, between the January 11th and the January 17th. That's when the meeting ended, right? So there was both inaction, right, and then also lack of risk communication with the public, right? People were completely unprepared for the outbreak. You saw that, when Dr. Zhong Nanshan announced, at the press conference, this is indeed human-to-human transmission, right? The Hubei, in Wuhan, there were still people celebrating, right? That this, after this potluck event, everybody shared dishes with each other. So that's like a fertile ground for the further spread of the virus. So essentially, like 2 weeks, if we count this January 7th as when the virus already was spreading like a gangbusters, right? Then there was a lack of inaction at the local level, right? Until January 18th, actually until January 23rd. So essentially, at least 2 weeks was squandered.
And what do you make of the mass quarantine as it is dragging on now for weeks? Is it?
It is very interesting that, as we were just talking about this, I found it interesting that despite this advancement in biotechnology, right, so far, but it's sort of, we still believe that the silver bullet, right, to containing the virus, still those centuries-old instrument, essentially, right? Cordon sanitaire, quarantine, right? The lazarettos, if you will. Quarantine actually is derived from Italian, means 40 days. Right? That was actually the first time implemented by the city-states in Europe. So the question here remains, how, to what extent these measures are effective. If you actually look at the SARS outbreak, the Chinese government like to say, well, because of their decisive measures, those mass quarantine measures, the virus died out. But that seems to be not that accurate. If you look at the data, in fact, the reproduction number of the virus, we call it R-naught, right? Actually, already was below 1, right? Because if it's below 1, that means that the virus lost momentum. It cannot lead to sustained transmission, right? It was already below 1 before the government implemented mass containment measures. So in that sense, this containment approach may prevent the spread of virus in unaffected regions, but it not leads to the factual containment of the virus. Okay, so for now, this one, again, you might make actually a strong case that indeed it prevent or at least contain the spread of the virus in unaffected regions, in regions other than Wuhan or Hubei provinces. But to what extent it actually contained the spread of virus in Wuhan or Hubei, I think that is a big question mark.
I don't think it did at all. I think it basically, Hubei was like a giant cruise ship off the coast of Japan. I mean, it was the sacrifice of Hubei province. It said, we're going to just let everybody, this can run amok in Hubei province, but we're not going to let it get out to our other cities. And if it does get out to our other cities, which it would inevitably do, we'll be able to contain it there with very few people isolated or by social distancing, which is like quarantine light. It's like, don't go to big public events. We won't have big public events, and don't do other things, stand a meter away from other people, but you don't have to stay home, right? So they said, well, then we can keep everything going by, if the embers of the problem in Hubei get out and they land in these other cities, then we can stop them from becoming fires by starving them of oxygen, by not letting the virus pass to other people in those areas with more limited quarantine. But that is not what's happening. And I think that a lot of that is because it's so much more transmissible than anybody expected. I think with SARS, as you mentioned, a lot of people people automatically do their own social distancing, like they will protect themselves and stay home, even without quarantine, for a period of time until they're tired of it. And that helps. And it helped pull down that R0. The R0 is a fascinating number. It's the number of people that one sick person will infect. For measles, it's 15 to 18. Measles, most transmissible disease known to man, if everybody's not vaccinated. Now, if you're vaccinated, that's now way lower. But the R0 matters. If it's over 1, it means your outbreak is still spreading, is expanding exponentially, basically, because every one person will infect 2 or 3 or even 1.5 is still a lot of spread. But if the number's less than 1, it means that every infected person doesn't even infect another person, which means you're definitely coming down. The whole goal of quarantine and all of these things is not to prevent everybody from getting sick, much as we in the US like to think of our health as being of the predominant, most important thing to everyone, and we must, at all costs, protect every single human being. That's not quite how it works in public health. Really, the goal is to get that R0 below 1, and then mathematically, the disease will burn out.
And can you remind us, where is it now?
Yeah,
where is
it's
R0
hard to
now?
say. So there have been estimates between 2 and 6, probably, somewhere in there. And that's huge, okay? That is not an error rate, like a standard deviation that you want. It's like way too big.
The SARS was between 2 and 5.
Yeah. But you can't really know right away because is this an okay time to talk about numbers?
Yes,
Yeah.
please. I was going to ask next.
So numbers are tough in epidemics because the same people who are supposed to count the sick, the recovered, the exposed, and the dead are the same people who are supposed to make the rules about who has to stay home and who has to be in this isolation room and who can go out and who can't and who's at risk. And I told you earlier that everything changes every day as you learn more. And so the rules change, and then you got to go and re-educate all the people so that they can enforce the rules, so that you can make sure everybody's following the rules that you put in place in order to protect people. And then oftentimes, these are also the people who have to take care of the sick. And so the counting is hard to get done. And so you can never 100% rely on numbers that come out in the middle of an epidemic. They're just, in the beginning, they're fine, right? The first a few hundreds cases. But once your health system starts to get overwhelmed, you can't afford, there's not like a pile of epidemiologists sitting around waiting for this to come up to do work, right? They're doing other things, and you have to pull them off those tasks to do this. So then someone else has to fill that job, and it just becomes unmanageable.
And so, Emily, are you saying that those numbers that look so solid are really not?
They can't be right.
Solid.
And it's not, I think, there's a possibility, of course, there's a lot of chatter about the Chinese maybe making this look a little bit better than it is and not report. But we don't even need to, I don't know if that's happening. But I will tell you, they can't possibly count all the people who stayed home with a cold and didn't even bother going to the hospital because they didn't care if they had the flu or had coronavirus. They were just going to stay in their house and get better and only go if they got sicker. And that's what I would do if I wasn't a doctor and an epidemiologist. But I mean, that's what a lot of people would do. So I think there are a lot more people in that denominator. The number of people who are sick is far greater. And the way to figure that out is by doing serological testing, to go back after everybody's done and take blood and say, do you have antibodies to this virus? Do you not? We're only now, I think I saw the first tweets today about, which I'm not sure are reliable, about about the first serological tests being able to be even done. So it takes a while to do those antibody tests. And so I think it's going to be a long time before we know really what the R0 was, what it is now. On that cruise ship, we can probably calculate it, though, which is what makes that kind of interesting.
But one day it will be fixed, right? Like we will have a definitive.
No.
Probably will still be a range.
It's always a range,
it's always a
because
range.
what you do matters,
Yeah.
right? So in a tiny little town in rural Illinois where there's one clinic and one doctor and most people live miles and miles away from each other, the R0's going to be very different than what's going to be on a college campus here. I'm not trying to scare people. That's not it. The university would be very unhappy with that. The point being that our human connections matter and what we do to help prevent things. You could also argue that the R0 could be lower on a college campus where people are paying attention and where we're going to put people into appropriate safe isolations or quarantines if needed in order to prevent spread, or at least to scatter people, get them separated enough that they're less likely, whereas there may be very little public health in a rural town, and so there may be everybody goes to church one Sunday and then, you know. So it's hard to know, but definitely our human interactions and our behavior matter for the R0. So it'll always be a range, but I think it looks like it'll come out between 2 and 6.
Okay.
Chang-Tai, you mentioned earlier the local Communist Party officials, and I'm curious, that they're in a really tough spot. They've been in a tough spot this whole time, and this is an incredibly challenging situation. And what are the various incentives that they're facing? Can you kind of help us see what they're up against?
Well, until a few days ago, I mean, it was clear that they had one objective, which is to get this down. I mean, that was the only. Now, a few days ago, President Hsieh also made another statement that they also have to get the economy up and running without providing details on how that was going to be done. So I think it was Yanzhong or something was saying about the conflicting signals, right? Signals, and I would love to be able to see the internal directives. I don't see them. But I don't know what exactly are the instructions on how that is to be accomplished, and what information or what signals they're getting from the party apparatus on how they're going to be punished and rewarded for, you know, if for example, if you're the mayor of what's that city that has this really large Foxconn factory? Zhengzhou, right? Right. It was the city of Zhengzhou. So that is a plant with 200,000 people. And now only a fraction of their workers are able to come back. Well, you know, if there's a major outbreak there, because the local party secretary heeded the second set of instructions to get the economy up and running, and there's always that risk. I mean, there's always, but he did get the plant up and running. What's going to be the, you know, what's the consequence of that?
Yeah, just to follow up what you just said, right? When you are a local government official, mayor, for example, you are being told, right, you need to improve your local economy. But in the meantime, you need to make sure there will be no new infections, right? The latter is apparently more quantifiable than the former, right? Because the local leaders, they are very strategic, right? They are only going to pursue or implement those targets, that objectives that are quantifiable, right? So now I would expect that they're probably still going to focus on
health,
containing the virus, right? Because especially when you are told, you know, in some localities, if you found like one more case, you're going to be in big trouble, right? They will certainly have no incentives, right, to promote the economy, because these two objectives are sort of self-contradictory in a sense.
That's my point.
But they don't need to be. From a medical standpoint, they don't have to be. You can say, we're going to switch to mitigation. People who are over this age shouldn't come out. They should stay at home. And people who are well should bring them food and things. And they shouldn't come to work at the factories. But people who are younger and who are healthy should. And we want to focus on not having any more deaths, not having any more cases. Just let the virus burn its way through. I mean, it sounds awful, but it's not. Look at children. So children, the newest pediatric information that came out shows that a ton of children are positive for this, but they're not getting very sick. And it seems age is the greatest risk factor. Certainly that method wouldn't be 100% foolproof, but it would be more balanced.
Can we say that it's actually going to, in terms of impact on the economy, this is my hypothesis, and certainly Chang-Tai, you could dispute that, right? Actually, since the age, right, the old age is the biggest risk factor, right? You would expect that in terms of the impact on the economy, the GDP per capita is technically could increase because you have,
That's brutal.
Probably. Just speaking on technological terms.
That's the economics of the Black Death, right? Because right after the Black Death in Europe,
the Black Death.
GDP per worker went up by.
Exactly.
Can I push you a bit?
Yeah.
So,
I'm not an economist.
No, but you seem to be hinting that what is being done right now, I mean, maybe you haven't even, you've said it, that what's being done, the massive quarantines. I mean, the other thing that I see is that the massive quarantine is not just there, but every city has been doing the same thing. So it's not just
No, it's not.
That
Not
initial
anymore.
strategy that you mentioned of trying to contain the embers, that everybody is doing the Wuhan strategy.
By the US public health metric of like 4 generations of transmission would make us want to reconsider and switch to a mitigation plan. If you were to apply that in China, then it's probably not appropriate to continue to have major quarantines. Now, I want to be clear. This disease it appears to be, the reason it was noticed is that it's worse than the common cold. It's not like influenza. It will come out with a death rate higher than influenza. 30,000 Americans die every year of influenza. We accept that as being part of the deal of the winter. And this would be like having another doubly bad, at least, flu season on the tail of our regular flu season. And it would affect more people because no one has any antibodies. This is not an easy decision to make, but it doesn't appear to be containable anymore. And so at some point you have to decide that you're going to maximize the resources to take care of the people that are the sickest and figure out a way. I don't know whether it's possible, but I would say anything you could do to help keep the situation from ending up like in Wuhan, we suspect and believe that there probably are people dying because they cannot get to a hospital. There isn't a bed for them.
Well, actually, I fully agree with you on the need probably to transition to a mitigation-based strategy. In fact, 10 days ago, I published a piece at China Newsweek calling for this transition. But I think at this time, it's politically not acceptable. Because actually, there are people in China saying that this implementation of the mitigation strategy during the 2009 H1N1 pandemic, it's indication of the U.S. being weak, being incompetent in dealing with H1N1.
And one point just to clarify, my understanding that a big driver of this economic impact, even though we don't know the full extent yet, is that there are so many migrant workers who are not allowed to travel back to their workplace, correct?
Right.
Potentially a third. And so it's really, it seems to me that at a certain point, right, China may have to decide, lift the roadblocks, let people travel again. And the question is, when? Does anyone have any thoughts on when that could happen, or what might be the driver? Like, is it going to take WHO, or is it going to be an internal decision?
I mean, Zhiguo was telling me today that you have lots of companies that are taking matters into their own hands, that they're sending out caravans, they're sending out charter planes to bring their workers back, to bring the workers back. And I imagine that part of that is that you also have to negotiate these deals with the local party secretaries to make an exemption for these people. So imagine this is something that Foxconn can do and Alibaba can do. So powerful firms can do this, but the typical firm probably doesn't have the connections or the resources to make that happen. Yeah.
Well, they're putting people back to work to make personal protective equipment.
Yes.
Masks, which we can't get more. We're not short of N95 respirators, but we certainly can't get as many as we want. No one can.
Well, actually, speaking of masks, this is actually sort of a bottleneck problem, actually preventing the workers to resume working because China has a maximum mask manufacturing capacity of nearly 30 million a day, but look at the demand side.
Yeah.
They need 1.8 billion
Right.
a day. Right? So I've actually received the calls from my relatives in China said we only have 2 masks at home, and we can't just even go outside, because either in this case you either go out right once every 6 days, or use the same mask for 6 days, right? And now we already have heard those cases of cross-infection when workers return to their factory. That even though that might be isolated cases, that would be enough actually to send this wrong message. It's probably not a good idea, to go back to work.
It'll take a couple weeks to know.
Yeah.
Because of the doubling time.
I would say one more thing about the masks. So this is something I have looked into. I've looked into the masks. Production of masks is heavily locally concentrated.
In Xiantao,
Right.
Hubei province, actually.
And then what I think is partly is going on is that the local authorities, they have every incentive to try to keep the masks locally. So the part of what I think is going on is that there's also what I'm going to call a misallocation of masks. Some places have too many, and other places don't have enough.
Emily, I wanted to ask, are you concerned about countries with weaker health systems? I know that many people in your field are, that if this starts to spread rapidly in some parts of sub-Saharan Africa, it could be much more serious.
The heroic containment efforts that China has been trying to do will certainly buy time for the rest of the world to be prepared for this. And that is the greatest gift, I think, that can be given from the suffering of the people that are in these quarantines, the difficult positions that they're in, that will buy time. It has bought time for us. Those embers take time to grow into fire. But there are countries that are reporting no cases or 1 case that obviously have far more. I mean, you can look at the modeling from the airplane traffic. They have far more people coming from China. There's no way that they don't have more cases than that. And there's, without any sort of public health system, it can be really difficult to know exactly what's going on. People are asking me now, at the hospital, you have to talk to me before you travel anywhere, especially in Asia, so that I can tell you if you'll be able to come back to work when you return. And a lot of people just ask, and it's spring break time coming, and I get emails every day. I'm going to Japan, I'm going to Singapore, I'm going to Cambodia.
Not a good idea.
I'm going on a cruise in Asia,
Oh, yeah,
right?
no.
That too.
I draw the line there. And I'm trying, but some of these people are going to see their family. Like they're not going on a cruise. They're going home, and they want to make sure everybody's okay. And it is really challenging to know what to do. We are probably, as in public health in America, in the US, they started out by just talking about Wuhan, and then it was Hubei, and then it was all of mainland China. And now we're at this precipice again where the restrictions and the quarantines and the isolations and all of that are being drawn around China, but we're obviously at a point where we're edging toward the next expansion of that risk area. And it's hard to give people advice about what's going to happen because the rules for healthcare workers and in universities, as you all have seen in your emails, are more stringent than they are in other places. And so certainly, I don't think we're going to have so many of our healthcare workers come back from trips to Asia in March and April that we can't function. But there really is a significant confusion about what to do in these areas. Yeah. I'm not sure what else to say. It's very unknown.
Yeah, and I think you alluded to this earlier, but we really may be looking at the tip of the iceberg right now.
It's there's an iceberg. I have no idea how much of it we're looking at. In different places, you're seeing different amounts of it. Singapore is amazing. If you want to read like a really good epidemiologic survey of this, search for Singapore coronavirus. And you will see, look at like the Straits Times. It's amazing. They'll like report out every single patient by case number, who they had contact with, where they picked it up, which cluster they're a part of, what their address is, what you're supposed to do if you live there, if you think you might have known this person. It's amazing, right? We're not that good even. But I still think that they're still having ongoing transmission in communities, third and fourth generations of transmission. They're certainly they're doing their best to keep it under control, but it's hard. South Korea reported, I think 50 new cases overnight last night. I can't imagine what happens when your country comes back with 50 new cases in one area. That's just, you obviously have an iceberg, and there's a lot of really challenging questions that China is facing right now, and they're facing a lot of places, and we're not immune to them.
Yanzhong, I'm curious, what are your concerns around we talked a little bit about this, but the social toll of the quarantine and the unintended consequences?
Yeah, well,
in China.
When you are doing the policy effective analysis, right? This essentially, right? We compare, right? The policy, the goals, right, to the actual, right, the policy outcome, right? Whether you have fulfilled the policy goals, right? So, to the extent that this is situation is being stabilized, right, nationwide in China, and even in Wuhan, it seems that now. Situation is improving, although there's still this question on how reliable the data is, also complicated by this changing methods of confirming new cases.
Yeah, it seems to be, yeah.
This is,
it's confusing.
It's causing all the confusion.
It seems to have created a nice peak.
Yeah. So, but anyway, then if you consider this, not just this cost-benefit thing, right? When you talk about those unintended, right, undesirable consequences, all those top-down mass quarantine measures have created, right? It's a lot, sometimes it's very hard to even, say whether this is really worth the while, or justifiable, because you talk about not certainly economy, but that's a big concern here. Some people predictions vary. Some say it might, the Chinese economy is resilient enough, right? You might have still more than 5% annual economic growth. Some, more pessimistic would say this is Chinese economy is going to shrink this year. But this is one, I'm not the economist, so I leave to Chang-Tai to elaborate that. But then you talk about other, right? There's unintended consequences in other areas, right? Like healthcare, conventional diseases, people. China, for example, has 800,000 HIV patients, right? They need life-saving medicines. This now, this is actually now they are in danger of that being the supply chain being disrupted. There are challenges of access into these life-saving medicines. There are also people, China has NCDs we call non-communicable diseases. 87% of the fatalities in China attributed to NCDs, right, including cancer, cardiovascular diseases, respiratory conditions, diabetes, you name it. Just for diabetes, there's more than 100 million people. This is world's diabetes capital. These people, they need, right, the support, right, healthcare. They need the medicine, right? But now this is all being interrupted. I have like a friend who just told me that his father-in-law was sick, and his mother-in-law was taking care of him, but because of lack of health care, his mother-in-law was infected, not infected, was sick and then died, and then his father-in-law was in critical condition. This is, I think, this kind of story is being repeated, across China. There's one, I think, hospital in Wuhan. They basically evacuated all these terminal cancer patients, so that the beds could be vacated for those coronavirus patients. So this also raised a lot of those ethical questions, right? To what extent, right, that whose lives was more, that the coronavirus patients or the cancer patients? So there are a lot of questions this raised, in terms of this evaluating the effectiveness of this approach.
Thank you. Chang-Tai, I wanted to come back to you. We discussed over email a little bit an interesting, provocative article by Ian Bremmer, CEO of Eurasia Group, where he made several interesting points. One, that a top-down system like China's makes a healthcare system more vulnerable. But he also said that China's reputation as a reliable trade partner may suffer in the wake of the outbreak. What do you think about that?
So I must say I haven't read the piece, so I can say, but let me take the 2 points. One is, I think I think it's commonly, so it's an argument you hear commonly, very frequently, that China is a top-down system. I think that is actually just a fundamental misunderstanding of how the Chinese system works. That it's a much more complicated thing. It's a much more complicated thing that in terms of how the economy operates, I think for large parts of the last 3 decades, it was very much a bottom-up system. It was very much a system in which it was what all these local governments were doing to try to get businesses going in their local communities. The second piece is on, now what you do see is that there are sometimes campaigns in which it's not really the central government, that's not the way that I would put it, but it's the authorities of the Communist Party make it clear that certain things really are a priority, like the virus thing now. It's clear that it is really a priority. Or 6 years ago, there was another big campaign that I haven't seen anywhere in the media, which is about the crackdown on pollution. Starting off 5 or 6 years, there was a massive crackdown on pollution that for decades, local governments just ignored. But starting 5 or 6 years ago, they took it seriously. I mean, they took it because now it was clear from, and it's not the central government. It's really not the ministry. It's really not where the power is, but it's really where that it was viewed that it became clear that this was a central. It was a central priority. So what you do see is that there's been massive cleanup. I mean, that's what you see, and I also think that there have been very big costs, very big economic costs of the crackdown on pollution. But the air is cleaner, and all kinds of all the indication. In terms of being a reliable trading partner, I guess it comes back to the answer I gave to the first question. It depends on what you see 2 years in the future. I mean, what you see, my sense is that everybody understands that there is an epidemic right now, and you can't, you can't fulfill your contracts. There's certain things that you can't do. I think that everybody, it's like, a hurricane hits Houston, and certain things you just can't do. And I think that everybody that's sensible understands that. The question is what do you see? once this disease environment goes down, what are local governments doing? And that, again, I mean, I guess we just don't know.
But now that Chang-Tai brought up that the issue of the environmental governance, I actually have a book coming out from Cambridge entitled Toxic Politics, China's Environmental Health Crisis and the Challenge to the State. So if now it's just like up on their website, so if you're interested, actually partially answer your question. If you're interested, feel free actually to pre-order it.
Thank you so much.
Sorry, doing this shameless self-promotion.
Can I ask the two of you a question?
We do have to move to audience Q&A now,
Okay,
I'm sorry. But maybe you can work it in.
Okay.
Please, and when you, there will be microphones circulating, and please identify yourself and ask a question. Thank you.
I'm Dali Yang in the Political Science Department. I have a brief comment and also a question. The comment is this, and I want to build on what Chang-Tai mentioned, actually. China actually developed one of the most extensive the CDC system for reporting infectious diseases. But that system did not function for this. In fact, in December, none of simply the doctors, the local hospitals, did not input the data into the system. So in many ways, I have a short essay coming out actually that discusses some of this. There are other mistakes that are also major to follow, just from a technical perspective, without dealing with politics, although there is politics definitely there. So the question is for Emily. What's your assessment for vaccine?
Oh, it's going to be a good long time before we'll get a vaccine. I'm hoping that it'll go faster than it usually does, and it appears as though some labs have already had vaccine candidates that they're ready to try testing in animals. But the process of testing for safety and efficacy is long. It's long because you want it to be long. You want to know that when you get that vaccine that nothing bad is going to happen to you and that it's going to do what you expect it to do. And so unfortunately, I don't think they're going to be able to stress it any faster. It was so nice with H1N1 in 2009 because it was just a flu, and we make a flu vaccine every year, and so it was just changing out the antigens. That could go pretty quickly, but this is not going to be as simple.
Yeah, it took 1 year to develop a vaccine for SARS, but when it came out, already all those cases were gone, so you cannot even put into the clinical trial to test how effective it was.
Some questions down here.
Hello, I'm Martin, and it's a great pleasure to meet you again, Dr. Emily. So the WHO has done a lot of controversial moves regarding the coronavirus, about the timing of their actions, as well as perhaps a naming issue of the virus. And some people speculate that the WHO is under the influence of certain political powers as well. So after this coronavirus issue, should we reevaluate our trust in the WHO people, and that they are politically neutral, or whether they are scientifically sound anymore? It might be a little bit too.
I think this is my question too. I think we have to let them make the decision about when it's a public health emergency of international concern whenever they want to. And I think that they made some really good points about it's really hard to go from red to green to red. You know, like maybe we need a yellow. And I think that that's fair. About the naming, the name's dumb. COVID-19 is
very
stupid.
dumb. Very
and
dumb, I agree.
It doesn't have to have Wuhan in it. I'm fine with that. Like, I think it's okay to not name viruses after the locations that they come from, although we kind of have done that for a long time. But this name's dumb.
It's
That's
just,
all.
Well, I would say it's not that creative. You know, I could.
Well, I don't think it's going to stop people from calling it Wuhan pneumonia. Like, I mean, I think it's like it doesn't serve the
They could
purpose.
have just found a bit. I thought to answer your question, right, that happened to have done the research on WHO reform. You know, WHO needs to reform. You know, that when Margaret Chan became the WHO Director General, she kicked off the WHO reform process. That was 2010. But unfortunately, that didn't work out in terms of fixing the funding structure and fixing this broader, this decision-making system that is the member state-driven process. So we have to keep in mind, WHO is not a super national organization, that actually it has to listen to what members tell them, that especially some bigger powers, unfortunately, right? That you would expect in the ideal world, as a technical authority, it will respond to the development in the biological world, right? But in the reality, right, that this in their decision making, it has to also respond to developments in the political world. I can only say that.
I think that history is going to give us a lot more, in the future, we're going to be able to look back on this with a lot more understanding of what happened, but it's really hard to make a lot of judgments now. It makes sense that China would have had the most influence. They were the ones with the infections. But did they have too much? Hard to say.
There was one question here, and one here, and one here. So first here.
Hi, Irvin Schindel. I was just wondering, what is then the level of cooperation between China and the US CDC? Because I keep on hearing on the news that the CDC wanted to offer a team to go into China and they were refused.
I've heard the same thing on every CDC press call and every CDC and public health call, but nothing more and nothing less.
It's actually just I was asked the same question this morning from a reporter. Well, in the disease outbreak like this, it's certainly now it's been declared public health emergency of international concern, which means you need international cooperation, right? So when the U.S. CDC offered aid to China, that I would expect China accepted that, right? But unfortunately, now in this case, this is all unfolding the bigger background of the deteriorating U.S.-China relations, this lack of trust, right? Misperceptions, now actually politicized, that decision on whether to accept the U.S. offer. And that also explains probably why, even though now finally U.S. experts joined the WHO team in China, they are not going to visit Wuhan, to my knowledge.
They're not.
Question over here.
Hi, my name is Peter. Just looking at that diagram up there, I don't see North Korea on there. Is anything known about the situation there?
Is anything ever known about the situation there? There's like stuff on Twitter about it, but I don't think any of that's, I wouldn't count it as reliable.
When North Korea shut down the land border with China immediately after the outbreak was reported in the country. And I think they currently, there's officially they have this virus free. I think there was
officially virus free.
Right, a rumor has it that there was an official, who visited China, returned without reporting. He was immediately executed.
That's what I saw on Twitter.
Okay, well, this is a rumor.
No idea.
Okay.
Hey, so Mike Koss here. I'm a graduate student at the Booth School of Business, and so I have two questions. The first is, as a total layperson, can you help sort of contextualize why this is such a global issue at the moment? Because, Emily, I know you mentioned earlier that, for example, the flu in the United States kills every year maybe 30,000 people. And so, looking at a number like 2,000 currently, it doesn't seem like it's this global health issue, maybe not at the moment. And then, maybe it's because it's more of, from an economic perspective, that, China's such a large economy, it has the opportunity to kind of cripple that. And then the second question is, it's February 2021, can I travel to China?
I will say, in answer to your first question about epidemic, why it's a big deal. It's really transmissible, and you have to do some math in your head in order to understand, but there's only about a quarter of people that are actually susceptible to flu any given year because of your past immune history and whatever, and the vaccine and all. It's 100% for this. And so if you do the numbers, you can read all these different people model what it's going to be. And it comes out being millions of people infected and then some proportion of them dying. But if you have 30,000 people die of influenza every year, it's going to be way, way more because way, way more people will get sick. including all those asymptomatic people and the children. And we don't know yet, because I can't tell you the case fatality ratio, because I don't know. And so it has the potential to be really bad. Plus, the other piece is that it's a really long illness. So people get sick for a week, and they're doing okay. Then in the second week, they realize they're sicker, they need oxygen, they have to go to the hospital. Then by the end of the second week, they're on a ventilator. Then they're on a ventilator for another week and a half, maybe. And that's a small proportion of the people. But if everybody's susceptible, that's more people than we have ventilators, on ventilators for longer than people are usually on ventilators. It becomes a math problem of we don't have a system. If those predictions are true, the more serious predictions that you see of like, you know, where you look at like 30% of Americans are infected, of those 20% need to be hospitalized. We can't do that here. There's not enough ICU beds or ventilators to handle that. So slowing it down, buying time, and figuring out what medications will help fix people earlier through the trials that are ongoing in China make a huge difference, huge difference.
Actually, to answer your question, this political science theory, basically when you talk about this, actually two different types of diseases, you know, seasonal influenza, right? This is something we have got used to it, right? It's predictable. We develop like the risk, you know, that is actually close to actually what the risk actually poses. But for like unknown, potential life-threatening disease like coronavirus, novel coronavirus, people is going to develop this exaggerated risk, right? This is what different type of risk, what we call dreaded risk. You know, that because they don't know what that virus is, still we don't have a lot of unknowns about that, right? So they tend to exaggerate the risk. And so for this type of this disease problem is the acute disease outbreak, the World Health Organization would consider that part of what we call global health security. You know, that, so that disease is subject to what we call securitization. You know, that requires measures beyond this normal political procedures, but not for the seasonal influenza.
Last question. Hello.
Thank you so much for the inspiring discussion, at least compared to what's on the internet. My name is Ray. I work at the economics department as RA. I have an iceberg of questions, but the tip of it is, do you think, or it's kind of two-folded, do you think the panic that is seen among the public is rational or justified? For example, so when there was like 2 cases in the US, my friends who don't even look Asian was on the bus and she cleared her throat and she was shunned by people in the bus. And you look at all these like reporting and panic on the internet, do you think it's like rational, justified, and what contributed to this, how we could do better? That's like part of it. The other is, do you think the media's attitude and everything towards what's happening is rational and justified, and it's unbiased? Because the thing is, hindsight is 20/20, but they did not have that. And if, say, the WHO says like, oh, they're doing an okay job, then people think, oh, they're rigged. So do you think that is justified, or is there some like biasness and some factors at play there? Thank you so much.
I'll just say that I think panic is never a good idea. Like, it's not going to help you get better or avoid getting sick or anything. And currently, like in the United States, the risk to everyone today is extremely low from everything that we know. And even if the virus does come here and make many, many people sick, the vast majority of people are going to be just fine after they're done with their illness. It may put a huge strain on our healthcare system to get everybody to just fine, but the vast majority of people are going to be just fine. And I think that the media can be really cruel. I think it's really hard. I want to be really kind to these people who are responding to this outbreak, because if it does come here, and I'm like in my hospital doing my very best to make sure every healthcare worker doesn't get this virus, and I'm going to work really hard, and we're going to do everything we can, but we might not do it all right. And so it's really hard to see a conspiracy theory or a conspiracy situation when I know that it's really challenging, this situation. So I'm not willing to go along with the conspiracy stuff right now. I just don't think that we need it. It's bad enough without that. We can deal with that stuff later.
panic is always bad for the economy, right?
Yeah.
According
Right.
to a study
Yeah.
conducted by the World Bank, 90% of the losses during the outbreak was caused by panic-driven, uncoordinated, chaotic response.
Okay, I think we are out of time. Thank you so much to all of you. Fantastic
Thank you.
discussion.